Welcome again to Lakeshore Focus, a weekly show highlighting the key issues, important events, and interesting people in our region. I'm Keith Kirkpatrick. We live in a country with one of the finest healthcare systems in the world, yet we know that a significant portion of our population lives without access to or the resources to pay for that same quality healthcare. With us today is someone who can help us look at these issues and their effect on our region. A warm Lakeshore Focus welcome to Denise Dillard, who is the Senior Consultant for Government and External Relations for the Methodist Hospitals. Glad to have you on the show.
Well, thank you, Keith. Glad to be here.
Well, you know, you're one of the people that I know knows a lot about this issue going on. I mean, you've been involved in healthcare. You've been involved in a lot of things in our region for a long time. But in the healthcare arena for what, about 8 years now?
Well, actually, 10 years. 10 years, yeah.
Time flies when you're having
It
a good
does,
time.
and it's been changing ever since I started, so it's been really
Well, what's amazing is that your 10 years at the Methodist Hospitals, you recently got some big state recognition for your work that you were quite proud of. Tell us a little bit about that.
You know, I was very, very humbling, a huge honor. The state of Indiana, like all the other states, have an association. Indiana Hospital Associations is ours, and it is the membership of hospitals throughout the state of Indiana, and your CEOs are predominantly the membership members, if you will, in terms of the board of directors. Then you have a government council where you have a number of people like myself and again other CEOs who really look at the policy and legislations and how we want to advocate on certain issues, how the message needs to be written, and how do we reach out to legislators.
And this organization gives a big award every year.
We get the award there's 2 awards, one to CEOs. One CEO is chosen out of the state that has done an admirable amount of work and has the respect of his colleagues as well. And then also there's a non-CEO that is awarded the Award of Merit for their advocacy and leadership throughout the state.
And who happened to get that award recently?
Well, I am the 2014 recipient of the Indiana Hospital Association Award of Merit.
So from out the whole state, you were the
Yes.
one that got picked this year.
Yes.
Well, congratulations,
Yes.
by the way.
Thank you so much.
So
Thank
what
you.
was interesting about this is you were not nominated necessarily by your own organization, but not to take away from that,
Right.
but you were nominated by some of the other hospitals.
Absolutely, which was just awesome. Joanne Bazell from St. Catherine was the senior administrator that had nominated me. And part of that, I think, is because in my knowing how we all work as safety net hospitals, St. Catherine, St. Margaret, Methodist, we've teamed up on a number of things. And I've had the pleasure of working with both of Joanne and Tom Grisback at St. Margaret. And we've done everything from looking at policies, looking at some of the fiscal issues that are very sensitive when you start removing dollars in the patient care
And so they said, this is the candidate from our region that we would like to get recognition, and then you won it for the whole state.
Yeah, I brought a lot of things to the state organization where we talked about advocacy for not just any one population, but a changing population as you look at families, as you look at the structure of households. We have a lot more people that are men needing insurance who definitely, may not have children.
Well, you've become a big advocate for these kind of things,
yes.
which is what we're going to talk about today on the show, among other things. But one of the things, healthcare in our region, economically, for a long time, the key economic leaders in our region have said healthcare is really one of our greatest assets. We have an incredibly strong healthcare system, yet we have a lot of people around here say, I need to go to Chicago because I don't want to go to the hospitals around here. Well, what's the story with that?
Well, I think part of it is perception that if you aren't in a university teaching instruction institution, that somehow you're not parallel or equitable, it's not equitable care. Certainly that's not true. Whether Methodist, community systems, Franciscan, we have a tremendous, Porter County has one of the newest hospitals, in the state. I mean, you've got a total I think, a restructuring of healthcare here in Northwest Indiana. I think that the hospitals are talking to each other more than they ever have. They're looking at services where they can partner on some things. Of course, there's still a competitive issue, but where we're talking about quality care and delivery, does everyone need to have a Da Vinci?
Yeah, I've
mean,
never
we've looked at
seen
those kinds of things.
such a high level of cooperation. I mean, a long time. I mean, I just see all the hospitals talking to each other and trying to work cooperatively.
Right.
And like you said, for resources, but particularly trying to really provide high quality health care for this region.
Exactly. We did a community assessment, which was a demanded piece of the health reform. And under Affordable Care Act, every community that was dealing with extremely high movement in health care in terms of where you were in evaluating whether you were having poor to good to average health care, be it access or the actual health care itself. People in Northwest Indiana heard that, and the hospitals got together, in fact, and partnered to do that community assessment. That was a big move.
And what was the find? Was there a couple of findings from
Absolutely.
that?
There's some differences when you're looking at Hammond, Gary, East Chicago, but there are some similarities. For Gary, for instance, there was a big issue of looking at trauma, looking at violence, also prenatal care, very big issue. Same thing in St. Catherine, looking at maternal health.
So the point is that we're trying to look at some of these things. Someone mentioned to me some time back that if you look at some of our physicians and medical professionals in this area, that many of them have chosen to be here in this region because they don't want to have to commute into Chicago. They do not want to have to deal with that. And so some really high quality medical professions say, I want to stay more local. I want to stay here in the region. So we get some really good people. Is that your feeling of it?
I think that somewhat. I think you do have a lot of good physicians that are dedicated to Northwest Indiana. But you also have a movement where physicians are in groups, that they are being contracted and employed by hospitals. So there's also a movement to where is the place for me to best move my professional growth, but also my quality of life. A lot of the doctors' attitudes, the younger doctors, they've changed from some of our older doctors. They're not trying to do 7 days a week and calls. And, a lot of the physicians are women now who are saying, no, I'm going to have a family. And I want that balance.
So there's a lot of change in healthcare, and many for the better from what we can see. Yet one of the biggest issues, and we see on the national stage, this debate over healthcare, we still have a huge number, I think 40 million people without healthcare coverage in this country. Well, first of all, if you don't have healthcare coverage, what are your options? I hear pretty much you wait till the emergency comes and you go to the emergency room. Is that kind of the deal?
Well, I'm sure that it is what we have done historically. It is not best for
Right, I
either
didn't
the
say it was
patient.
best.
Right, no, I get you. You did not, but it is still something that when people get flustered, that's access. And emergency rooms still offer, access.
And I think that's still believed by most people that you might be turned down any place else, but if you go to the emergency room,
you don't have your meds, if you are really, in pain, and you don't have insurance.
So is that true anymore? I mean, can someone who doesn't have insurance just go to the doctor and?
They can. Well, I don't know about going to a doctor, but I know that they can go into an emergency room, and they will treat you. They will find out what's going on.
Do you have other options besides that emergency room?
Right now I think all the hospitals are gearing up to try to help people get insurance. That's really the issue. We want you to get insured. Through the Affordable Care Act, looking at the various systems and the various standards where you can buy a la carte. Really, we want you to take a look at that. Now, obviously, and this is the issue with Medicaid expansion, if you have no money, just even if you're saying, well, it's only $25 a month, that becomes hard. And so that still leaves a big population that becomes vulnerable.
Of that population that really has no insurance, I mean, roughly, what percentage of them are just barely surviving? They don't have that extra $25 a month.
I don't think it's what people talk about. Really, a lot of the examples of people without insurance, entrepreneurs, attorneys, who will come in and they've been in a firm for, they're self-employed, but they don't have health insurance. They have been paying for everything. So then you get to some kind of medical illness that's much more expensive. That's a different thing. The medications now, the drug industry, huge. I've seen things just like, some colleagues who did not have insurance who were in the workforce system. And for whatever reason, and I can't speak to why they didn't have it, but they didn't have insurance. And just getting something like their blood pressure medication, asthma. I've had several people call me and say, I'm working, but my costs went up to $300 for my inhaler. I just don't have it today.
And so we've got a mix of people in this portion of our population that's not insured. Some really can't afford this, and then we've got other people who just, by circumstances, just haven't got plugged into the system.
Right.
But it seems like we're a year into this process now, and I'm not noticing the number has dramatically changed. It looks like it's maybe 1% of that group. We've gone from like 17 to 16% or something. It's not a dramatic change. Why is that not happening fast enough or faster?
Keith, when you say dramatic change, I would say middle-class America has reached out for insurance. Okay, and now they still are going through some of the problems of navigating the system. That's why most hospitals have hired navigators. Your federally qualified health centers, FQHCs, that's something that they are all equipped to take a potential patient, and say, let's get you signed in, let's get you plugged in to some insurance. Now, it is not a easy situation.
That's what you hear from a lot of people.
Yeah, it's still, the computer time is horrific. You might be on for 4 to 5 hours sometimes. I mean, it can get heady, but it is so worth getting involved and getting signed in.
So one of the issues we still have is kind of the bureaucracy of
Absolutely.
it all, or this whole system of doing it.
Right.
But what about that person who really, about the mom who's got 2 kids, who's making minimum wage? I mean, obviously is barely paying rent, putting food on the table and gas in the car if she has a car. And really, to come up with $25 or $30 a month is nearly impossible,
Right.
if impossible.
Right.
I mean, what is that person's option?
Well, we still say that we need to look at them for what programs are available. There are some. With children, Medicaid, hence the Medicaid expansion, that's huge, because what you just gave an example of is a person economically still is challenged, has 2 children, the head of household, whether it's male or female, there's going to be some things that are going to be needed for those children.
Well, let's take away the children piece, because that does kind of put a different dimension. What if it's a single person who's 28 years old, and they've got that minimum wage job that it's just, and again, with an apartment and everything, they really have no discretionary money to pay for that insurance. And they say, well, I'm young, I'm healthy. I think I'm just going to pass on it until something bad happens.
And we would say, let's try to get you insured before something bad happens. There are ways of doing that. There's a la carte. Maybe all you're going to get right now is major medical. Maybe you don't need any medications.
So what if I tell you, I'll role play a little bit here, I just can't afford this, Denise. I'm just barely paying my bills. I have no extra money every month. I have nothing to pay for insurance.
Well, I'd want to get you to a navigator. To talk about what are the resources that are available that may put you on a payment plan, or something where it might even be a sliding scale, because obviously the clinics, the FQHCs, they are on sliding scales. Some of them have medication that they can give you if you're qualified. So there are other resources, but you've got to stick with the process of making sure people know what you need.
So actually, I might need to change my cell phone plan, or quit buying cigarettes, which is probably creating part of my problem anyway.
Priority on healthcare becomes the issue as well.
Okay.
I hear people who will say, I just don't have anything else to work with. But here's another thing. By law, there's going to be a penalty. There'll be a penalty if you don't have health care.
We heard about that. Is that really going to, you think that's really, do you really think that's going
to happen?
well, not to happen, but will that really incentivize me that person who's, am I going to be really scared of getting a penalty? Really? What are you going to get from me? I can't even afford insurance. What are you going to do, penalize me and
I
charge me?
think your middle, and this goes back to something you said. A lot of people with the Affordable Care Act focus extremely, are totally on poverty. And that's not really the population that's affected without having insurance. It's middle America.
Because
It's
many of
middle
them,
America.
again, have Medicaid or
Absolutely.
some sort of assistance.
Absolutely. It is middle America where you're working someplace and you're part of the workforce where the employer was not sponsoring insurance or the premiums were so high, that
Which
you
what happens to a lot of small businesses.
absolutely,
They go, oh my gosh,
absolutely.
I can't do this.
Or you're a 1099 contractor, as you're going out there, so you're uninsured. This is a group that gets bombed if something comes down in their life. That's a medical disaster because it can definitely bankrupt you.
And it
It
does.
can definitely bankrupt you. And middle America is the group that's most hit with the lack of insurance, not poverty.
So what happens to the hospital? Okay,
Mm-hmm.
again, I'll role play a little bit here. So I'm uninsured, something dramatic happens, and the hospital hits me for a $80,000 bill. I'm like, are you kidding? I cannot pay $80,000. What happens to me and to the hospital when we're at that impasse? I can't pay $80,000.
Right. Well, you probably will end up getting sued.
Okay.
I mean, I'm
All
just
right.
being honest.
Sure.
You'll get some, bad debt situations that the collections will come. They might, the hospital, most hospitals will try to modify the amount and work with you on a payment plan before it gets to that. But $84,000 on a debt is just a large debt. And that's why when they looked at the bankruptcy situations here in the state of Indiana, you saw that most of them were based on medical, that something had happened. And so that's why there's a lot of community benefit, bad debt. Sometimes that's an interesting balance.
Well, when I've talked to people before who've told me that they've got this medical debt, I will often counsel them and say, go talk to them.
Yes.
And what you just said was, payment plans can be set up, adjustments
Yes.
potentially can be made if they realize you don't have this money, correct?
Exactly. And sometimes, just like in the housing market, after things crashed and people started hearing all these news reports about come in and talk to us about a modified mortgage. The same is true in the healthcare. If there's a point where you've been served, I don't think any of our hospitals in Northwest Indiana will not look at how do we negotiate. Because if you owe 80, logically, they'd like to get some recouping on it.
So why are people so afraid to do that, or do they just not even know that's possible?
I don't really know why they're so afraid. I think that most of it is just not realizing that you can work out something. Lots of times you hear about a person's own financial understanding of why it's the right thing to do, to just call and say, I'm in trouble. I thank you for the care I've gotten, but I just can't afford this. I bring home $800 a month. I don't have it. So those are conversations that, they need to have with a financial counselor, in those hospitals.
I think it's back to, again, just a lot of people don't understand the dynamics of all these issues, and so they just kind of go, I'm just going to ignore it, right?
And in the midst of so much, in the midst of so much that people are going through, when it's a financial issue, it's just one more thing. And so you finally say, I got to have my health because I can't make any money if I don't have my health. So what the heck? I just had to do what I had to do and we'll figure it out.
But a lot of people are not that logical, right?
And that's not the real effect for a lot of people. Like I said, middle class America, that's not really the issue. The issue there is the lack of insurance, the huge expense, and then adding that as part of your financial responsibility.
So where do you think this is all headed down the road? I mean, we had kind of a year and a half, 2 years of horrible debate prior to the implementation. Then it was like a whole lot of criticism after the implementation. We're a year into this. Where are we down the road? You have a prognostication for this? Some prediction of where's it all going to end?
Well, I'm a believer that America needed the Affordable Care Act because we needed to reform our existing healthcare structure. You know, if we're paying 24% of our gross national product in healthcare, that's huge. You know, and not just compared to other countries, that's just huge. The problem, of course, is that it's not going to happen overnight. We've started by saying we needed to have something out there to get legislators and the president and everyone aware that change is coming.
So reform is the key
Reform
word in
is
that,
the key.
and people, I think, miss that point. It's about reforming
It's
a
reform.
system.
Right. And the system is not just about when you're sick. It's about preventing you from getting to that point.
So we're
And
trying to shift to that too.
Yes, America has been, let's take care of you when you're sick. America has not been, you know, let's focus on the fact that we don't have exercising in the school systems. And so that might be a problem for why we have more kids who are juvenile diabetes prone at the age of 12 than we've ever had.
The political debate has been to focus on all the things we disagreed with instead of the things that really made sense to be moving toward. And that's what you're saying. So in the end, do you think it's all going to work out, or is it just going to be a bloody mess for the next 2 or 3 years? And I shouldn't use bloody in terms of medical, should I?
Yeah.
But
Yes.
I think that's a good question.
Well, it is, Keith. I don't think my glass half full says that I think we're going to work together. I think that from a congressional and presidential level, executive level, that obviously the Congress has changed parties. We're going to see. Everyone's saying we want to work together. You know, it has to happen. It has to, and it's not because of 2016. It has to happen because in this country, if you are not able to access health care services and quality health care services, you have affected everything in the communities. Your communities become devastated when they are unhealthy.
The system is very complex, and we need to make some changes. And you're one of the people who's advocating for those changes, and I deeply appreciate it. And I'm so glad you won this award. So
Well, thank you so very much. I appreciate the confidence of my peers.
it was well deserved. And thanks for being on the show today. I appreciate it.
Thank you, Keith.
All right.
My pleasure.
Bye-bye. While the healthcare debate rages on in this country, large numbers of Americans continue to be without health insurance of any type. Gallup research indicates that to be 16% of our population, around 40 million people. In a nation blessed with the best healthcare system on the planet, it is a tragedy to have so many living without a way to pay for such a basic need. I know that many will point to the European countries or Canada and ask why those nations are able to offer health care to the vast majority of their populations, and we Americans cannot figure out a way to do it. Critics respond by pointing to the wavering or weakened economies and governments of those countries. It seems like a tough trade-off to think that we can have either health care for all or a strong economy. We Americans see ourselves as resourceful, innovative, and able to find solutions to problems that other countries cannot. Then why is it that we cannot solve this problem? Our founders stated in the Declaration of Independence that all are equal and entitled to life, liberty, and the pursuit of happiness. Clearly, a person's health is directly related to having life. It is also rather difficult to have liberty when you are shackled to bills. Finally, it is evident that you cannot be very happy when you are sick or facing a life-threatening illness. Some of the criticisms of the Obama administration and Congress for enacting changes in our healthcare system may be justified, but the harsh attacks are often just hateful. I applaud any leader who's trying to address these problems in meaningful and constructive ways. It's hard to imagine what any of us can do to address such a gigantic problem. My suggestion, when you have the ear of a leader who can address it, whisper, everyone is entitled to life, liberty, happiness, and health care. We'd like to hear your thoughts about today's show and your reactions to the program or my closing comments. Email us at focus@lakeshorepublicmedia.org or reach us through our website, which is listed on your screen. Remember, you can also watch past Lakeshore Focus shows from our website. Join us next week for another Lakeshore Focus. Until then, I'm Keith Kirkpatrick saying, make a positive difference in our world today.